Good morning.
Good morning.
How are you?
I'm great and yourself.
I'm good. Okay, why don't I hear you coming through the Oh, because you're coming through here. Okay. You sound I,
Do I? Is it better now? Maybe I just need to talk up.
you're low, but I hear feet. I hear it sound crunchy. That's all I
Really?
got to say. Like somebody crunching paper. Wait a minute. Let me see if I what you sound like on YouTube. Say something.
How about now? Testing, testing.
No, you sound crunchy there too.
Okay, well, let me.
Yes, she said AI have a world on chokehold. Yeah, don't he sound crunchy? Is it just me? It
How
may be
about
the
now?
yeah, it's like static, like sound. Yeah. Say
Still?
something.
Even
Do it again.
now? How about
No, you
now?
sound better.
Oh, okay.
You
So
sound much better.
I took this earpiece out.
Oh,
I'm wired in.
okay. You sound much better. I don't know. You know what? So I have an old pair, like I guess the first edition whatever they call AirPods, whatever they call. And then I got a newer one, not the latest release, but a second generation or something. And every time I put it in my ear, like I can hear for a minute, and then all of a sudden I hear like static, like the TVs I'm about to date myself. The TVs used to do when they go off. I'm like, what in the world is that? And I don't know why. I'm like, is it about to go out? I just be like, forget it. Let me go either to my first generation. The only problem is it doesn't hold a charge as long as it used to. You know how stuff just wears itself out.
Right.
Or like you got the wired ones and put them in and be like, whatever it is, what it is. How are you doing?
I'm doing good.
Oh, wait, I hear that in
Yes.
the voice. Hold up. I love it. I love it. Well, I guess we need to like okay, let me just for disclaimer purposes. I've been in here trying to figure all these things out and put everything together. And my tea is sitting on the kitchen table. So when you do your introduction, I'm gonna be running to go get my tea.
Okay.
Okay. It's brewing. It's just sitting there. Wait for me to go get it. All right, all right, all right. So welcome everybody to the Saturday morning tea, my favorite time of the morning, where where we discuss health information, news, education, certification tips, entrepreneurship, mm, fraud and abuse, and the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button, letting us know that you were with us. Um, I'm Clarice Warner, the Girl with the Pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And I got caught up because I was reading somebody else's message. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask, do you know what it takes to be a certified marketable medical coder? Do you? Are you interested in that? Hopefully. Well, before I introduce my co host, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. To make it back. Right. Okay. You know. This this is gonna be an indication of how this morning is going to go. Okay. So if you are interested in getting more information on the 5 steps to become a certified marketable medical coder free email course, then find the information. There's a link in the description I know it's a lot of information down there, but I promise you it's close to the top. You can find that link. Click on that link, especially if you're joining via YouTube, Facebook, and LinkedIn. I don't see anybody over here in Clubhouse, even though I'm out here, but your link is at the top of the page if you're joining. But you could be watching the replay. So if you're watching the replay, because the replay does play, watching the replay, the link is at the top of the page. Okay. So joining me today is my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been in healthcare for 30 years. During the I transitioned into HIM in 2014. And during the pandemic in 2020, I created a company called The Coding Nurse, where I help other nurses and other people in healthcare with clinical backgrounds transition into the wonderful world of HIM.
Yes. And so how's that going for you?
So far, so good. I am finishing. This week is our last full week, and that'll be my last class until January.
Okay. And how are your students?
This crew is a little rough. Like they don't think that reading is fundamental.
Oh, oh my God. Well, that's normally the case. We've grown into a society that, one, I think everybody just thinks everybody's supposed to give you everything. Let's start there. And that you don't need to read. Because so-and-so said whatever. So it must be the law and the rule and all of the things. And so I don't really need to read it for myself. I don't even need to know where it's at. I don't even care. That seems to be the case. I don't know where that came from. I need to see it with my own eyes and process it with my own brain. And that's just me. But for some reason, we out here, folks is just out here living life.
They are.
According to somebody else's terms, rules, how they paraphrase. I don't know.
Yeah.
One of the reasons why, even though we bring the topics, we talk about the various topics, and we provide our opinions or we provide our take on it. I give you the link. Go out there and read it for yourself.
There you go.
I don't make this stuff up. I promise y'all. I don't make it up. It's out here. Folks, it's out here. Wowing.
They are.
Wowing. Cool. So before we get into our discussion and topic today, I want to remind you all that, as I recently mentioned, we bring the topics, but we expect the conversation. This is a conversation. We want you to talk about it. We give our opinions and we give our comedic spin sometimes on things, but we like to hear from you as well. This is, it's a virtual. I'm going to steal from Iyanla. It's a virtual living room where we can sit and discuss the matters surrounding our profession and our take on healthcare. And so your opinion matters here and it's welcome here. So feel free to jump in. For those of you who are joining Facebook, YouTube, or LinkedIn, you all know what to do. You use the chat to give your piece. And if you have a question, please type Q first so that we know it's a question for us and we don't miss it. So for those of you who are joining us or watching the replay, today we're going to talk a little bit about the OIG Fraud Risk Indicator. And so we're going to understand what that is and what that means for you. The OIG be out here OIG-ing, to say the least. However, before we get into our topic, you know what time it is. It's church announcements time. So let me get us queued up. Yes. Good morning, everybody. Thanks for joining us. You're absolutely right. You said I wish it was made up. Unfortunately, it is not. Yes, it's my favorite time of the year. Thank you for joining me. Good morning, Sarah. That's a pretty good rap. Is it your name?
This music is perfect because you can imagine them setting up the tables for communion.
I keep it today. Like, when we get after the meeting, I'm going to be like out the box upstairs. Have my
That's right, crafty coder.
Yes. Oh, I love it. I love it. Everybody know what that means. Everybody knows what that means. Okay. So our church announcements for today are around our paper reports. Okay. Around our pepper report. So the comparative billing reports is another name for them, but technically it's your pepper. CMS is issuing a comparative billing report for nursing facility evaluation and management visits. And if you don't know, and I think we've talked about it, I know I've talked about it, what the pepper reports are. This is a way for you to kind of gauge where you sit with your peers in a particular industry. So if like I said, this one is for nursing facility evaluation and management visits. Do you want to, what percentile are you in? Are you above the 80th percentile? Are you below the 25th percentile? Where do you fit with those in your state, with those nationally? And then it gives you like your own snapshot as well of what it looks like. And so this is a tool that allows you to see, we may be out of our visits, or our services may be billed on a higher scale. Not to really panic, if you will, but allow you the opportunity to test and see why. So is it because of our payer mix? Is it because our patient mix? Is it because we have patients who need an acute or a higher level of care? Or Houston, we may have a problem. So, but this gives you an opportunity beforehand for you to understand if these are improper payments, if you are billing improperly, if there's a coding issue, if the documentation is whatever is going on. This gives you an opportunity to kind of do a quick little review and take a peek on what's happening. The other thing I wanted to mention about this particular one, it's relatively new. With their comparative billing reports. And because they're actually having a webinar on Wednesday, November 8th from 3 to 4 p.m. Eastern Standard Time. And this webinar will actually go over and review the comparative billing reports, what you need to look for, what you need to find. You can register. The link is on the YouTube, in the YouTube description box. It has where you can register, and then you can also get the handouts. The handouts are great. They actually give you like a sample peek at what they give you a sample peek at what the report looks like. It walks you I mean, the handout is just the bomb. It walks you into all of the things of the PEPR report. They also tell you what the CBR or the comparative billing reports are not. They're not an audit. It's not something to make you change how you clinically care for your patients. It's not that. It's not a request for a response. They're not looking for charts. They're not looking for information. It is not a medical review. So there hasn't been a medical director or medical professional to take a look and review any of this information. It's more or less an aggregation of data. It's data analysis. This is what the data is telling us, and we're showing you where you fit. And also, it's not an indication of any type of wrongdoing. Now, so this particular CBR, everybody won't get this. Again, it's around nursing facilities, and not all nursing facilities will get the information, but you have the ability, if you are the medical provider, if you're the owner, if you're the compliance officer, I think if you're the quality person, and there's one other person that you can check off to actually get your CBR from their portal. You can access it. Oh, wait, here it is. If you're the CEO, the president, administrator, compliance officer, owner, or healthcare provider, also you can do a special request, but they automatically usually go to your quality people. Yeah. And so one of the reasons why they're doing this initial nursing facility E&M visits is there has been a 13%, well, in 2022, they found that there was a 13% improper payment rate for nursing home visits, which represented over $251 million in improper payments. And the types of errors that they found for these improper payments were incorrect coding, which was 67.7%, insufficient documentation, which was 23.8%. So again, this gives you an opportunity to kind of go in, take a look, see what you got going on. And this CBR is from services from January 1, 2022 through through December 31st, 2022. Yeah. So that is my church announcement for today. Mr. Jesse, you have anything you want to?
Actually, I do have a church. Well, I think it is. Well, I guess it could be considered a church announcement. So,
Yes.
we have been talking about our Patreon,
Mhm.
and we had talked, and we wanted to have an entrepreneurial lean to it.
Mhm.
And what I'm going to say here, because you're going to have to come to the Patreon, there is so much information out there. And actually, I had a consultation with a woman who has been doing government contracting for years. She's a veteran, and she actively she helps people get contracts, and she actively has contracts. And it is just so much information out here, and I really I'm learning how to navigate those huge federal websites to find out what's going on, to really drill down about where the information is, who is getting what, and how much. There's so much information out here, and I really think that it would be in all of our best interests as HIM professionals, as people who have experience and knowledge, to look into these contracts and join our Patreon, because I will give the information there. I will drop some hints here, but we need to get to this money.
Yes.
Point blank, period.
Yes. And this is how. Oh, wait, where'd she go? And this is how. Improper payment gonna make me rich.
Mm-hmm.
Exactly. Let's see. see how hard is it just to check the dang rules. Exactly. But because they don't, and we already talked about it, because reading is fundamental, and I guess folks don't feel that way anymore. They better go on back and listen to Reading Rainbow. Stop playing.
That's right. And with all of this outsourcing, working for or contracting with the government is a way to hedge that, because in order to get government contracts, you have to be in the United States.
Mm-hmm.
So
Mm-hmm.
that eliminates a whole lot of competition.
So our meeting after the meeting is going to be juicy. Yeah. So again, there is a plug for our Patreon. This is where not only we provide some additional context around the things that we talk about today and kind of debrief on those things, but then we also right now, entrepreneurship is the key to unlock a lot of doors, and we're walking piece by piece, step by step, walking our folks on how to get to the bags. Get to the bags. Are those dollars? Get to the bags. All right. Good information. Okay, let me take this down. More comments. I gotta keep. Yeah. She said, what was the chat on TikTok? I think that's supposed to say money. Money come to me, money goes through me, or whatever they say. Right. I hear you. All right. So today I wanted to bring your attention to, and I guess this is probably not one of the sexiest comments. Let me just say, I told y'all how every Saturday morning, like clockwork, I swear there's something on their radar that says, you know what, she's gonna be talking this morning. Let's make sure this hits her inbox before she comes. But my friends over at the AMA, boy,
Lord,
they got a whole section about scope creep. And it's like, I think it was 4 different articles. Now they have escalated. Now they're getting researchers, and so they're getting their evidence on research around why non-physicians don't provide quality care, and the care that they're providing is at a higher cost. So there's a whole art. I didn't bring it up. I wasn't going to even talk about it, but I just thought it was amazing. I was like, I need to find out on the other side what's happening on their piece. Even though we heard about last week with the VA about to shut all their stuff down, but that's neither there. Yes, Miss Renita, come on in and check the description box on YouTube, and you'll see the information about our Patreon to be in the meeting after the meeting. Starts at 10:15. All right. So let's get to it. So today we're talking about the OIG and their fraud risk spectrum. So I got another email about all kinds of folks and their fraudulent behavior and fraudulent activity. And I was like, whoo, they not letting up at all. I don't know if they got more agents. I don't know what's the deal, but the OIG is not playing at all. So let's see if I can bring this up. So primarily they use the False Claims Act, and that's their tool to determining and dealing with any type of fraud. So in most of these False Claims Act cases, they do one of several things. Usually it's a settlement. And so the government will say, they are alleging there's some sort of fraudulent conduct that happened. And I know folks get out and because sometimes it's not like blatant fraud, but it's and I can hear somebody would say this all the time, but it was just a mistake. It was just a mistake, but it was a mistake made a gazillion times, but it was a mistake that was made that that you should have known or should have had the people in place to know, to catch it and determine and decide, oh no, we've made this mistake, and then do the right thing and self-disclose. So that's part of the group of folks that the government may allege fraudulent conduct. And then basically the party, usually they don't admit any type of liability to it at all. So they try to meet kind of in the middle. Depending on all of the facts and circumstances that are presented in these cases, the OIG will do again one of several things in settling these federal cases of healthcare fraud. There is exclusion, and yes, the OIG has the right to exclude. They have been given the authority and power to exclude folks from federal government, that's the same thing, payment mechanisms, Medicare, Medicaid, TRICARE, all of the things. Heightened security, even grants, but that's heightened security is another thing that they could do. Integrity, obligations. They can take no further action. They can kind of let it sit and see how you hang yourself. And then in the case of a good faith and cooperative party, they who did self-disclosure, they can take the self-disclosure as it is and pursue no other things. So the OIG has a risk spectrum that kind of shows how they approach these different tactics that they use. So the long and short of all of this is on their risk spectrum. And so let me show my screen so you can see this here. Okay. So here's the risk spectrum. And okay, there we go. So you can see the highest risk and then the lowest risk. And then they will determine what that looks like. If it's in the highest risk, they can exclude, or that's where the exclusion portion sits. Then you have heightened security, the CIAs, no further action, and self-disclosure. The corporate integrity agreements are just, I love them personally as a compliance professional, because it then organizations who've sat under a CIA, while it is a taxing exercise, folks it's a lot of work. However, when they come out of that, they are all the better for it, especially within their compliance program. So, Mr. Jesse, I know you've talked about, you've been at organizations, you don't even know who the compliance officer is. You don't even know anything related to some of those compliance functions. All that changes when folks sit under CIA, because they have to, there's a regular cadence. I want to say it's like every 30 days. It's a very routine cadence for them to have to deliver documents, deliver information about training, deliver all of the things under a CIA for years, at least 3 years. I think 3 is the minimum, 3 to 5 years, depending on how well they do. So if you're a good player in your CIA, then you are let go a little sooner. But if you're not such a good player and you still want to put your feet in, be 10 toes down, or like they say about Deion Sanders, 9 toes down, 8 toes down, then you sit under that CIA for a further or longer time. Here is what it has looked like for fiscal year 2023 from the first through the fourth quarters so far, or to date on this. There were 16 exclusions, 2 had heightened security, 29 CIAs, 181 no further action, and 7 self-disclosure. Now remember that no further action is kind of that wait and see type of thing. And yeah, I would make sure I would double check and make sure all I's are dotted and T's are crossed if you're sitting in that. But what I wanted to also talk about in this was the exclusion. And as I mentioned, the OIG has the authority to exclude individuals and entities. So not only will you be excluded, but your organization or your entity will be excluded. So if you are and I say this particularly to those small individuals or groups that are new startups, they will exclude you and your MPI, and they will exclude your organization and its MPI. So remember that. Okay. So this talks all about the exclusion authority and activities of the OIG. And people can be excluded for all kinds of things, but if they have a conviction for Medicare or Medicaid fraud, is one of the reasons that folks are excluded. And those that are excluded can receive no payment from federal healthcare programs for any items or services they furnish, order, or prescribe. This includes those who provide health benefits funded directly or indirectly by the United States. And this is other than the Federal Employees Health Benefits Plan. Now, the OIG maintains a list of all currently excluded individuals and entities called the List of Excluded Individuals or Entities, or LEIE. They may have a word for that. I'm just going to say LEIE because I don't want to butcher it if it is. Anyone, anybody, anyone who hires an individual or entity on the LEIE may be subject to civil monetary penalties. Yes, you are responsible to make sure that you are not hiring anyone who has been excluded. When I told you that I received the email this week about the OIGing, a lot of the information was around parties who had to pay civil monetary penalties because they had hired people who were excluded. One, I still didn't understand how all that happened. The person didn't have a license and they were excluded. Make that make sense. What person in HR is not doing their job? Or whoever has been assigned to do that. But not only is there a federal list, but your states have a list. Because sometimes they don't they don't match initially. So the state may get the information before the feds get the information, or vice versa. And so it's up to you all, so that you won't be, if you are a hiring entity, to make sure that somebody is checking both the state and the federal list to avoid that liability. And you should check it on a regular. So not only for your new hires, but folks be doing stuff once they get the job. So there should be a routine check for current employees as well. Mr. Jesse, any questions, any comments?
I just wanted to jump in, and we have a question from Raspberry in the comments, but what I am finding, or at least in my opinion, there's a lot of information out there, but I think that it is just so, it's not all in one place. So it's not just one place where you go to it's just a checklist of things to do. And I think that because the information is all over the place, I think that it gets lost, and some people don't even, although when you're in certain positions like credentialing and compliance, you're supposed to know where these things are so you can do your job, but not everybody does, unfortunately. But those exclusion lists are real. And as an example, I had somebody who reached out to me last year, a nurse practitioner who wanted to start, she wanted to contract me to do billing. Come to find out, she was excluded on the federal level and was trying to get approved for state Medicaid services. I'm like, ma'am.
And so I've anytime I take on a client locally, I go to the list. Let me see what's happening over here. I go to the state and federal list because one, we're not gonna waste each other's time because I'm not fooling. I'm not touching you at all. Period. Because I can't help. I can't help you. And I tell people all the time, I'm not putting none of my credentials, I'm not putting any of my stuff on the line for foolishness. So that's kind of my whole spiel when I sit down with my clients in our introductory meeting. I'm not playing those reindeer games at all with anybody. And I've seen some folks and I'm like, especially, well, I don't know if you've encountered this, but especially in that low-lying fruit area of home health, you'll see folks, they'll be on the exclusion list, but they'll still be working somehow in home health through a different name or different entity or different whatever. Like they'll flip their stuff like we change clothes, which would be daily. And so that's why they stay in the crosshairs of the OIG because they know y'all game. They know what y'all doing. It's just like, here we go. And all you got to do is follow the patterns because you've established your pattern. Nothing is changing about how you do or what you do. You just changed your name and changed who the owner may be and changed who you may have hired to, because all of the people within the organization are not excluded. It's just those people who are either owners or actually providing direct services that are called into question are excluded. So y'all just figure out how to rally around and put some more folks in place and start it all over again until, unfortunately, one day somebody going to jail. And I guess that's when it'll all stop. But yeah, so this is something that I just wanted to show that's part of what the OIG does, part of their work. When you see information about, well, why did they do this? Why did they take this action versus another action? Again, that risk indicator is used for them to determine which way they need to go. And then I specifically wanted to show you the exclusion list because your folks is out there. That list is long. And I don't know about your state, but Ohio, it's a doozy. It's a doozy, but it's all nice and alphabetical, and you can easily just, well, let me look up so and so. Oh, they've been excluded for, and it gives the date. It gives a brief little information, and yeah, all the things. She said, "Oh, I've always wondered why that question is asked." Yeah, and so that question is asked twofold. One, they're testing. It's a test for you because are you going to be honest and say you've been excluded? So they're checking that. That's one way to check that, and then they're going to still check it regardless of what you say. They should check it because they don't want to get those penalties. Then for the folks in the back. Okay, so here's a question. Oh wait, before I get to her question, she said, "You get a CIA, you get a CIA. CIA's for everyone." Yes. But I love them. I think they're great. I remember when they first came out. Okay, so how can new coders protect themselves from fraudulent activity they may not be aware of? Within the organization or? I needed some clarity. Did you need clarity or you got it on this one?
Oh, I think I got it because for me, like my response to the question is every new coder, especially if you're certified, you have agreed and attested to
the code of ethics.
Yes, the code of ethics. So it is in your best interest to familiarize yourself with the code of ethics for whatever organization has certified you. That's first and foremost.
Mm-hmm.
And then all you have to do is, from that point, just follow proper coding guidelines.
Mm-hmm. And she said yes
And
within the organization.
mhm.
Yeah. So to Mr. Jesse is 100% correct, because you have a personal responsibility for your work product, regardless of the organization. And I know there have been several instances of coders and billers. I'll throw some billers in here in this one because they've been hit with it too, who have been directed based on policies and procedures and SOPs and all of those types of things to do things in what could be considered a fraudulent manner. And I'm not a lawyer by no stretch of the imagination yet. However, I'm still contemplating. However, my advice to them and recommendation for them is, when you see something that is awry or doesn't align with your code of ethics, what you see in the guidelines, what you have been instructed to, because you personally can go out and look at the rules, the regulations, your max, all of the manuals are public knowledge, and they kind of spell out and iron out, this is what this looks like for you to build this. This is what this looks like for you to build that, or code this or code that. At that point, I would make sure that there's some written documentation. Hey, I saw, you can have a conversation. I saw this. Is this right? Does this match? Here's some guidance that suggests that we may be doing this kind of inappropriately, or we may be doing this wrong, or whatever. You can have those conversations. If it hits a brick wall, I always recommend you may want to go tap out to your compliance professional. Hey, I talked to my manager, or I talked to so and so. This didn't look right to me. Are you aware of any type of contradiction here in what we're doing versus what the guidance says? Or maybe I'm, you come in like you don't know, but you know. Hey, maybe I'm misreading this. Maybe you have a better interpretation. Maybe you can help me understand. La da 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 da. All the while, on so and so day, I talked to my manager about such. On so and so day, I escalated that up to compliance, and I told them so and so. On so and so day, I'm still waiting on responses from anybody or whatever. You keep a record, and you can keep that record in your office, but you also make sure you got a copy away from the office, in case something could potentially happen. And then if something potentially happens related to that, that's a whole other can of worms. My friend over there has loves to throw his hat in for key tams. That too may be an option. But at least first and foremost, try to, because sometimes people just don't know. I mean, they just don't know, and they think they may be doing something, or don't know that something has changed within the guidance or regulations or whatever. So I think trying to provide the information for people, and get them to right the wrong internally would be the initial first step. Again, I will always make sure that you have documentation on it all. Period. Point blank. Yes.
I totally agree. And I just think, because from in nursing, they teach you from day one. Ignorance of the law is no excuse for violation.
Mm-hmm.
Like, when I tell you, they drill that into your head, and so you can't say you didn't know, because you're supposed to know.
Yep, that's
Like,
your job. That's your job.
like, it's like there's no wiggle room. And I just think that, well, I do. Well, the problem is, and this is not just in HIM, but the problem in society, period, is we have people in positions who have no business being in these positions.
Mm-hmm.
And the sad part about it in the HIM space, when you have people like that, and you have, because I've just it is the power dynamics in HIM is just very, very interesting to me, and I wish that somebody would write a book about it, because I find it amazing how, when you think about it, like I say it all the time, like, providers are like petulant children, like you want to do what you want to do, and then when somebody says no, then you want to scream and holler. But yet and still, when when somebody comes after you and says that you have to pay back $5 million, then you want to still scream and holler. No, no, no. And this is why you have policy. This is why you have checks and balances to prevent these kinds of things from happening. And you really have to save them from themselves.
Mm-hmm.
That's really, really what you're doing.
Mm-hmm.
And people, for whatever reason, just can't seem to understand that. And, like like I'm precepting somebody. So she had to send a query to the provider and asked for, because the diagnosis did not meet clinical criteria.
Mm-hmm.
So the provider answered that the condition was ruled in and was asked in the query to list the clinical indicators. They didn't list the clinical indicators. So she was like, "Well, are we supposed to write back?" I said, "No." I said, "Because your job as CDI is to query. The
Mm-hmm.
physician said the condition is ruled in. So now at this point, it's between him and the insurance company. You code it like he said and let it go."
Yep.
What else can you do? Like, that's not your job to make somebody do something. No, 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 no.
Mm-mm. Mm-mm. Like, even in compliance, I say all the time, because compliance can be a stressful occupation as well. Especially revenue cycle compliance. But you can't take it personal. You can't, because again, you have to you have to give the people the choice to do whatever it is that they're gonna do. Your job is to inform and provide the information. And I do my job and I walk away. You're gonna do whatever it is that you need to do. Preferably you're gonna do the right thing, because then here you come back. Oh my God, we got this, we got that. Can you help us? It was like all of this could have been avoided had you just done the right thing. But that's why they keep folks in compliance around. Crafty Coder, I totally agree. I keep mass insurance on me personally and in my organization. Yes, ma'am. Yes, ma'am. She's had the same E&O for at least 8 years, whether employed or contracting. Because yeah, it's crazy out here in these streets. But this was the best. See something, say something. Y'all in the revenue cycle project hood. Exactly. That is exactly. And BCC everything. Back it up. Back it up. Yes. Compliance is extremely stressful, and I'm always the bad guy. Yes, they think you come in to police, and I always tell them, I always start out with, I'm not here as the police. I'm really here to help you. I'm here to help you do the right thing. I'm here to provide you with information. I'm here to guide you to what is in the law, or what is in the guidance, or what that you may have missed. I'm here to help you do the right thing when no one is watching. Because folks will be like, oh well, if we just do this, really? Okay. And you organizations come in with you come in with your missions and your visions and your values, but do you live those things? You say it because it sounds real good and it's sweet coming out your mouth. It tastes real good. But do you actually live it when the rubber meets the road? And that's where we in compliance try to help you understand, hey, you said that this is who you are. Is this really who you are? And if it is, be that person in all things, not just when folks see you. not just, you know, when you are visible, but even in the dark. Be that same person. Be the same person.
That's right.
Yeah. Yes, ma'am. Couple of million. Nobody's playing. It's the
And
cost of doing business over here. So yes, ma'am.
the thing about it is, it's not hard.
Mm-mm.
It's not, but it's just the ego is a powerful thing, and it has destroyed civilizations in the past. And it's just like, I'm not trying to, you know, and people get bogged down in feeling like they're being told what to do. And I'm not, my whole mantra has been, I'm not trying to tell you what to do. I'm trying to tell you what you got to do to get paid and to keep your money.
And keep your money, because
Because that's the whole key, keeping it.
So
For
they
now,
pay you. You
yes.
you give the information. You send the invoice, you send the claim, you send the whatever. They gonna pay you, but can you keep it? Can you
That's
keep it?
we're approaching 2024. The government is still prosecuting people for PPP loan fraud. Still.
Still.
So it doesn't matter that you got $800,000 in 2021. They coming for their money.
They coming for that money. I hope you put it up. If it wasn't
Exactly.
right, I hope you put it in some investments or something that you can easily pull that out and pay them their money. Hope you ain't spending on the bag. Crafty Coders, you are absolutely correct. Doctors don't scare me. The OIG does. Absolutely. Because they're not playing at all.
And then getting back to the documentation piece, like, you just cannot, like, it once again, you know, in nursing, if it's not documented, it didn't happen. If you didn't write down that you gave that person that medicine, you didn't give it to them. End of story. And documentation will save you, because, you know, you have a lot of people who say, oh, well, you can't quit a job and get unemployment. Yes, you can. I did it. And what got me my unemployment was my documentation.
That's right.
When it said upload documents, that I know whoever did my claim, they were like, well, what in the hell? And sure enough, in my decision, they had the information I had submitted, and said that this, you know, claimant made his objections, and the plaintiff, or whoever it was, however they had it worded, the company did not do anything to address my specific issue.
Mm-hmm.
And that was how I was awarded, because what they were doing was wrong, and I was telling them, and they weren't trying to change. And I'm like,
And you lucky that it was, well, they're lucky that it was just, you decided, you know what, enough is enough, I'm out. Just pay me my unemployment or whatever. You could have whistleblown.
oh, and somebody did afterwards.
See?
And I got contacted by, and look, as they say on A&E, an investigative reporter. I sure did. He found me through LinkedIn.
For real.
And came with receipts. I'm like, oh.
Wow. Wow. That's what's up. See, you never know. You never know. And those conversations, they stick around. Trust and believe.
Mm-hmm.
Folks know. They know. Yeah, she said, yes, you can. And she also has sat right there on unemployment after quitting. Yep. Cool. So I hope that helped you, Raspberry. I love that name. I hope that gave you some insight on some things that you can do. And again, I mean, I don't want you to be jaded and think that every organization is doing something shady. That is not the case. Again, like I mentioned, it could be an honest mistake. But if that is the case, then someone needs to be alerted to that honest mistake and make the appropriate corrections and changes as needed,
because
so that they don't so it doesn't look like fraud to the government.
Exactly. I worked somewhere, once again, not long. And I noticed that this name kept popping up because I do, one thing about being in HIM, it will make you a detective. Like, you just naturally just look up stuff.
Exactly. Your whole skill set, that folks don't even understand the skill set that we have for real.
Yes.
Like you said, detective, investigator, all of the things. But go ahead. I'm sorry.
And I noticed, I'm like, well, wait a minute. They invested money and then they're also a client. So I'm like, now it is legal, but you have to disclose that in what they call a safe harbor agreement.
Mm-hmm.
Otherwise, it becomes otherwise you go into it becomes a kickback. So I asked, I'm like, well, does this company have a safe harbor agreement with so and so on file? Oh, I don't know. I'm like, okay. And this involved a former U.S. senator. Oh, yes.
Oh.
Man, people don't realize it goes down on the back end.
On the back, it goes down. Yeah, I'm part of the Scooby-Doo gang.
Yes.
Yeah, she said our parents had us job scared. They did, didn't they? Like, you better stay here forever. You got a good old job. You better be here. But there are no pensions anymore. So I'm out with my little 401k to the next. Amen. Amen. And she said, yes, thank you. It helped. Oh, we're glad to be of service in the service. One more time. One more
yes.
time. That song just hit me real quick in my spirit. Cool. So yeah. I just hope this was something that was useful, that was helpful, that again allows you the opportunity to when you see something, say something, gave you some concrete ways on how to say something, an action plan on what to do when you say something, and protect yourself as well.
Absolutely.
Yes. So you never know. You think you're coming into a field where, oh, well, I'll just do this and do that. Okay. It's all kinds of things circling. She said, welcome raspberry to this side of the world. Yes, absolutely. It's all kinds of things that's involved in what we do in health information. All kinds of things. Folks don't.
And people also don't realize how heavily regulated it is.
It is very regulated.
And all you got to do is just look up. They'll tell you what you got to do. They'll tell you how to do it.
Oh, that meme you sent to me. Oh my God, about the nurse should have been plumber. And we was having that conversation. I was talking with a gentleman locally about, we were talking about the OIG and their investigation into nursing facilities on those particular drugs that they were using to sedate the patients because of not having enough staff, and not because the patient needed to be sedated. That's a whole different thing. And, of course, there should be documentation to confirm that. But they're just sedating people because they don't have enough staff to manage all the residents in the facility. And we were going round and round and round. Of course, some of the excuses and stuff that he was saying, of course, he's no longer in the nursing home business, thank God. But I just kept, there were three of us in this conversation, and I just kept going back to, why are you doing this? Why are you in the business of healthcare if you're not in the caring business? Like, you see dollars and you think, oh, here's an opportunity for me to make some money and this and another. I was like, and he, we were talking about ratings. You got the 5-star nursing facilities and 1-star. I said, first of all, you probably were at a half a star because you were so busy trying to get money and not even invest any money or dollars that you get into your facility so that you can raise your star. And that's with any business. You invest back into your business to elevate to the next level. So if I'm walking, because it was like, yeah, and it was so much regulation and so much, dude, you dealing with people's lives. And because he didn't have the clientele where there were family members that were coming and seeing about those patients, I guess, if he felt he was doing them a favor, well, I'm taking them. No, those are still people, whether they're family members involved, whether whoever, they are still people, and you are taking them to care for them, period. And if that is not the reason why you in it, don't get in it. Don't be about that life. That's not about you. Don't do it. Why?
Exactly.
Why? And dude said it like, you need a different trade. If you're a nurse and you not caring for people, you should be a plumber. Go plumb. I was hollering.
And he's exactly right, because I promise you, until I became a nurse, I mean, because I got into it when I was young in my 20s, but I have never prayed for good health more than after I became a nurse, because I've seen it. And because I used to tell my friends all the time, I'm like, if I look up and see some of these people taking care of me, I'll pull the plug my darn self. Exactly. Hand me that cord. I'll rip it out myself. No. You ain't gonna kill me. I'll kill myself first. No.
Yes, I was just, like, oh, well, these people got money and they got families to come see them and they this, that, and the third, whatever. I'm like, but so you can't attract any of those types of clientele, because when I walk through your door, I see a big gaping hole that's dripping and leak. Why would I come here? Why would I put my family member here? Of course not. I've even seen the people, the caliber, or whatever. Oh, you got to pay the people. Yes, you got to pay people to do a good job. Their job is to care for these residents. You need to compensate them to do their job. And if they're not, they need to go. Period. You don't just try to get the bottom of the barrel. Let me just get this part. Oh, they need a job, so let me just slide them a couple dollars. They'll come in. But then garbage in, garbage out. Period. That's in everything.
And what a lot of people also don't understand, and also this goes to a case management issue too.
Yes.
Because what people don't understand is, a lot of times when these case managers are looking for placement, they're just looking for a bed. They don't care where it is. They don't do any due diligence. All they know is, this person has been in this facility 10 days over their DRG because we can't find someplace to take them. The first bed that they find, they're going to send that person regardless of where it is. They will even send people out of state.
They ain't got no family here, so ain't nobody gonna be looking for them.
Exactly. And I've seen it. I think I might have told you the story before. I used to live in DC. I worked at this nursing home, and I remembered this patient. I don't know why I remember this woman, but I just made an impression. I just remembered her. I moved to Baltimore years later. I come into work. I go in the room. It's her. They didn't send her because they closed the nursing home in DC. They sent her to Baltimore. So if your family doesn't have the resources, that's a hike. And also, you need resources to go an hour away. You need to have lunch. You need to have car fare. You need to be able to move around and be able to have the time to do it.
Yes.
It's just, it is
a whole mess. You said, meanwhile, Amazon has a clinic. Ma'am, that's a whole conversation. That's a whole conversation that we will touch on soon.
Yes.
That we will touch on soon. So we are at the top of the hour. Thank you all again for joining the Saturday Morning Tea or checking out the replay. Now, let me ask you, was the tea spilled today?
Yes, it was.
I had to go get my tea. So yes, definitely. I got 3 bags in here. So yes. If this information was valuable for you, please help us share this message with others by sharing the video, subscribing to the channel, word of mouth. Tell somebody about these people over here that's giving you the real on health information. Also, be sure to follow us for more information on all things health information, compliance, revenue cycle, and of course, medical coding. And as you leave out, don't forget to hit the thumbs up or like button. That helps with others being able to see that we have something that somebody else might need to listen to. Also, check out the Coding Nurse channel on YouTube. He drops the gems as well. So again, this has been a great session today. Mr. Jesse, do you have any closing words for the people?
It's just that, you know, every Saturday we try to bring value, and I'm sure I know we do. So every Saturday the tea is spilled because we show you how to maximize your knowledge in this HIM space and what
That's
to look
right.
out for and how to just move around safely and compliantly.
Yes, yes, yes. So again, thank you for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. And for those of you on Patreon, we'll see you at the meeting after the meeting.
I didn't get a link.
Sir, it's not in your
I only got one StreamYard link. Last week I got two.
It should have been both of them. Okay, I'll send it to you.
All right, thank you.